Attitudes toward mental health and psychotherapy in Pakistan. Variations by gender, age, education, marriage, profession, and income. Attitude is defined as a learned predisposition to respond in a consistently positive or negative manner with respect to a given object. Attitudes are the predictors of expected behavior. Research has suggested that attitudes towards mental health services are evaluative tendencies and predictors to seek professional help. Eisen's theory of reasoned action suggested that behavior's intention precedes the behavior itself. He further elaborated and proposed a theory of perceived behavior control, which emphasized that behaviors can be well perceived through attitudes. Thus, a person's intentions for a behavior may directly predict his engagement in the actual behavior. Seeking psychological help means communicating with other people to obtain help in terms of understanding, advice, information, treatment, and general support in response to a problem or distressing experience. Formal help seeking may involve seeking help from different mental health practitioners, teachers, youth workers, and religious figures. Studying the attitudes towards seeking psychological help has been found extremely helpful in understanding the help-seeking behavior. Help seeking for psychological problems can be formal and informal. Instead of the proven benefits of psychological counseling and psychotherapy, people usually prefer to take help from informal sources such as family members and friends. Culture plays a very significant role in developing beliefs about health and well-being. Culture also sets standards for the accepted and unaccepted means of treatment. Pakistan is a developing country. Majority of its population is Muslim. People commonly follow a traditional collectivistic culture. The state of mental health literacy in the country is poor and people are still reluctant to focus on their psychosocial issues adequately. The attitudes of public towards mental health and its counterparts in Pakistani culture were not specifically studied earlier, and there was a significant knowledge gap in this regard. Only 2 earlier studies were conducted in Pakistan which merely inform us about the general trends of Pakistanis in seeking psychological support, such as consulting spiritual healers and taking suggestions from family members. 2 other studies which were conducted on Pakistani community residing in the United Kingdom revealed lesser utilization of mental health services by women due to their negative attitudes towards mental health and consulting irrelevant persons for mental problems such as faith healers or general medical practitioners. Based on the general clinical observations and informal feedback from mental health practitioners, it was perceived that Pakistanis do not give the same weightage to their mental problems as they do this for other medical issues. Their attitudes towards mental health and its cure, in other words, were not as positive as their attitudes towards medical or biological symptoms. Studies from other cultures also reveal that mental health is still stigmatized in both developing and developed countries. A handful of earlier studies also reveal that Asians, as compared with Westerns, are less likely to utilize mental health services. Indian studies also reveal similar facts and emphasize on the role of religious, supernatural, and astrological explanations in valuing mental health-related issues. In a Muslim culture like Pakistan, mental disorders can be seen as test or punishment from God or as possessions by evil spirits, compelling people to understand mental problems in a more religious or supernatural terms. In one of his studies, Dr. Sukoon intended to find out the prevalent attitudes of Pakistanis towards mental health, mental disorders, mentally ill, and seeking psychological help. The study involved 2,702 conveniently selected Pakistanis from different major cities such as Islamabad, Rawalpindi, Peshawar, Lahore, Pakpatan, Sahiwal, Mansehra and Peshawar. A detailed research questionnaire in Urdu having 27 items was used to gather data. Preference in selecting the appropriate psychological support was the first construct of the questionnaire, which was measured through 2 open-ended questions. The data gathered from these 2 questions were qualitative in nature, which was further dealt with a thematic analysis and was quantified in percentages. Statements in Urdu language were developed for the constructs A. Attitudes towards mental health, B. Attitudes towards mental disorders, C. Attitudes towards medical illnesses, D. Attitudes towards mentally ill, and E. Attitudes towards seeking psychotherapy. The findings revealed that Pakistanis had slightly positive attitudes towards overall mental health. Females had significantly more positive attitudes towards mental health as compared to males. Young adults had more positive attitude as compared to adolescents, adults, and elderly. PhDs had significantly more positive attitudes towards mental health as compared to people with lesser educational qualifications and uneducated. A gradual positive incline in the attitudes towards mental health was also observed with the increase in educational qualification. The upper middle class and the well-off both had significantly more positive attitudes towards mental health as compared to the lower middle class and the lower class. The findings also revealed that Pakistanis had extremely positive attitude towards psychotherapy. Females had significantly more positive attitudes towards psychotherapy as compared to males. Single people had more positive attitude towards psychotherapy as compared to married, widow and divorced. Adolescents and adults have more positive attitude towards psychotherapy as compared to young adults and elderly. People with PhD had significantly more positive attitudes towards psychotherapy as compared to their counterparts. Lower middle class and upper middle class had more positive attitude as compared to lower class and well-off. Pakistanis also had slightly positive attitude towards mental disorders. Females had significantly more positive attitudes towards mental disorders as compared to males. Young adults had positive attitude as compared to adolescents and adults, whereas elderly had slightly negative attitude towards mental disorders. Divorced and single people had more positive attitude as compared to widow and married. People with PhD had significantly more positive attitudes towards psychotherapy as compared to their counterparts. The upper middle class and the well-off both had significantly more positive attitude as compared to lower class and lower middle class. According to the findings, Pakistanis had extremely positive attitude towards mentally ill. Females had significantly more positive attitudes towards mentally ill as compared to males. Young adults and adolescents had more positive attitude towards mentally ill as compared to adults and elderly people. Widows had more positive attitude as compared to single, married and divorced. People with PhD had significantly more positive attitudes towards mentally ill as compared to their counterparts. Well-off had more positive attitude as compared to lower class, lower middle class, and upper middle class. The respondents of the aforesaid study were also asked about their preferences in seeking psychological help through an open-ended question, that is, who will you prefer to consult for possible psychological problems in case you decide to consult someone. The top-ranked preference by the respondents was psychologist 31%, followed by psychiatrist 19%, religious practices 16%, medical doctor 12.21%, seeking help from family 8.88%. The aforesaid study by Dr. Sukoon measured attitudes towards mental health through different dimensions. These mainly include overall attitudes towards mental health, attitudes towards mental disorders, attitudes towards medical illnesses, attitudes towards mentally disturbed, overall attitudes towards seeking psychological help, attitudes towards seeking psychological help for self, attitudes towards seeking psychological help for family, attitudes towards seeking psychological help for children, attitudes towards seeking psychological help for friends. The findings revealed a trend of having positive attitudes toward the understudied variables. Women had more positive attitudes in this regard as compared with men. Education and socioeconomic status were also found positively correlated with having positive attitudes towards mental health and its counterparts. Attitudes of public towards mental disorders have been widely studied in different cultures and have been found varying across cultures. Mental disorders have been stigmatized in many parts of the world due to lower mental health literacy, lower educational qualifications. People with mental disorders have been considered dangerous, violent, unpredictable, incompetent, and unlikable. They have always been discriminated, and even some psychiatrists and other medical practitioners hold negative attitudes towards them. Media has played a very vital role in stigmatizing people with mental disorders more negatively. The prevalence of negative attitudes towards mental disorders hinders in seeking psychological help. Seeking psychological help has been thought the last option by even those who badly need it. Seeking psychological help requires trust on the therapist and willingness to disclose distressful feelings, which seems difficult to most of the people. Most of the research has revealed that men, as compared to women, seek lesser medical assistance and lesser psychological help. The earlier research has revealed that the divorced or separated seek psychological help more frequently than the married. The finding of the earlier studies on age-based differences in seeking psychological help have revealed mixed results. People with higher education use psychological services more than those with lesser education. Self-concealment, self-disclosure, belief-based barriers, and cultural differences also contribute in taking the decision to seek professional psychological help. The aforesaid study by Dr. Sukoon has deeply investigated the prevalent attitudes of Pakistanis towards mental health and the related aspects. The study has, uniquely, provided the latest facts and figures in this regard. The findings of the study can be extremely beneficial for the stakeholders. A very important discovery of the study is that Pakistanis, if compared with other developing countries, have more positive attitudes towards the entire area of mental health. This reflects their readiness to utilize mental health services, if available properly. Mental disorders are not strange to them, and they generally do not stigmatize people with mental illnesses. Although they do not give mental disorders the same importance as they give to the medical illnesses, yet they prefer psychotherapists, psychiatrists, and general physicians over other non-scientific interventions. The mental health practitioners and mental health service providers, in the light of the study, may target married educated women more as their prospective clients. On the other hand, they can also target the entire society for mental health awareness raising to enhance the scope of mental health practice in Pakistan. Thanks for listening. To read the entire paper, kindly visit www.dersakoon.info.